Well, once again on Sunday, we have the chance to talk to the Minister of Health and Social Care, David Ashford, and what's been a very interesting week. Certainly, David, as you know, my leading question was about this incident that was going on with a woman who'd come back from Liverpool. So maybe I'll start with that before we go into questions. By the way, we've got lots. Any movement on that? Any second thoughts, or is it still the same situation? They're having to isolate separately.
Well, it's the same situation because it's down to clinical advice. I mean, I do need to be absolutely clear that myself and the Chief Minister have no powers to exempt anyone or to issue any exemptions. The regulations specifically are drafted quite rightly, so there can't be political interference. The decisions on exemptions aren't made by politicians in relation to patient transfer, they're made by the clinicians. In this instance, the clinicians basically were unanimous that there didn't need to be an exemption. I have been in touch with the partner of the lady concerned, email correspondence, and I have asked the clinical body to look at it again.
Oh,
but they are the only ones who can make the decision.
Oh, well, that's something. I mean, I think that's what my point was. It just seemed like we're such a small place. Surely we have that ability just to go, let's look at this again. And I think that's probably fair enough that you can say that now.
Yeah, I mean, that was to be. I needed to speak really to the partner first before I could make those sort of comments, so I couldn't make those at the press briefing. That's not going to guarantee, by the way, I need to be clear that anything will change. The clinical body may come back with exactly the same thing and say no exemption is required, and we can't change that if that is the case, but it is being re-looked at.
Thank you. Okay, on to some questions. Has there been any adverse reactions to the vaccine so far? If so, how many adverse reactions and in what ways have they been adverse?
I'm not aware of any. There are strict protocols around the Pfizer vaccine, which is what we've been delivering so far, around who can have it and who can't. There's a full form that has to be filled out where people, if they have had previous reactions to vaccines or they have certain health conditions, can't have the vaccine. So that is all a pre-check prior to the vaccine being delivered as part of the handling protocols. To date, I'm not aware of anyone having had a reverse reaction. That's not to say there hasn't been, but I wouldn't necessarily be informed on an individual case-by-case basis, but there certainly doesn't seem to have been any really adverse reaction because I'd be likely told about that.
And would both those vaccines make you have to sit there for 50 minutes? Because I assumed it was only the original one, the one that had to be kept very cold, that had any adverse reactions that I'd seen in the media. But are you keeping the protocol the same for both vaccines?
Yeah, the protocol is the same for both vaccines. It's standard vaccine protocol, to be perfectly honest, that people should be, even if for a very short period of time, monitored after something's delivered to them. Interestingly, I noticed there had been an update saying that there's some people who can't have the Pfizer vaccine that can have the Oxford, and vice versa, actually. So where that's a option, that will be looked at on a case-by-case basis medically.
Well, we always said you'll answer questions on all subjects. This is probably more an Alf Cannon one, but here we go. After coming off a 2-week unpaid Christmas break, as no one wants you, then to be told you cannot work for 3 more weeks, but you'll be paid a fifth of your wage, and now you can't go back until there are no cases for 14 days. How on earth do they expect us to make payments on our machinery, let alone our mortgage, and feed our families?
Well, Treasury has now expanded, particularly for those who are running businesses, into a grant scheme. So the grant scheme is now up and running, the £1,500. That is now available because Treasury does recognise that people will have problems. There is MIRA available. Now, I recognise that's nowhere near the salaries that people would generally be bringing in if they were actually working full time, but it is a support package at the end of the day. We're hoping this will be a short, sharp circuit break lockdown. At the moment, some of the signs are encouraging. It's still too early to say with my cautious hat on, but it is encouraging. But Treasury has gone that extra step. And for those who are self-employed with business costs, there is now the £1,500 grant available as well.
But you're keeping your eye across that, obviously.
Yeah, and obviously Treasury and DFE is continuing to look at the packages. So if for whatever reason that we do need to extend and it does need to go further, then obviously the packages will be looked at again.
Now, many people have come back to me. Obviously, it's the same question you've answered over and over again, but, why not?
There's never a problem with
the rollout of the vaccines now. Any update, why it's taking this time?
Well, we can only vaccinate based on delivery. There's worldwide demand for vaccines. We receive our vaccines as a percentage based on per head of population from the UK. So we get 0.13% of UK supply. the way, obviously, this is brand new, so the manufacturers are only just ramping up production. So the deliveries don't come in an even level over the next 9 months. What you will see is staggered deliveries over January and February. And then when you hit March that the deliveries start ramping up as the manufacturers produce the vaccine and the UK starts getting its share of its pre-orders. And that's when the numbers start going up. So although it might seem to be a slow, steady pace at the moment, once you hit that peak of orders going up after the start of March, then that's when you'll start seeing the vaccination numbers rising exponentially.
Okay. I live literally 2 minutes from the testing tent and have had a test prior to an operation before Christmas. I asked could I walk down and be tested, was told no, I'd have to come down in a vehicle, whether it be a friend's or family or a taxi. Obviously, we weren't on the lockdown then, but under the circumstances, surely it'd be safer for people who can to walk there wearing a face covering and keep their distance from anyone. Where do these taxi drivers go once testing has finished? They go back home to their families or carry on working, picking people up, as usually they are lined up on Victoria Street. Do they take names of people so they can be traced if needed? Wouldn't have thought so. Keep up the great work. Oh, that's too
right. So if people do need to be traced, the taxi bases from the phone calls have contact details of who has contacted them and who's been with which driver. In relation to taxis, they have strict cleaning protocols as well. So there's cleaning protocols in place if they have to take someone through the test centre that they have to go through before they can go back and pick anyone else up. They have to have protocols around ventilation of the taxi too. That they're required to meet. In terms of the person, the public health advises that people shouldn't walk to the test centre because if people are contagious, even with the best will in the world and them trying to keep social distance, there is always the possibility they could come into contact with someone or touch surfaces, even unknowingly, even if they're trying to be, they're trying to abide by the rules on the way up.
We've got another one about taxi later on. I did an interview with someone the other day. I'll come back to that maybe. But anyway, next question. I've been out on exercise and met a nurse of my acquaintance. She tells me that, to the best of her knowledge, there's been very few, if any, of the night staff at Nobles Hospital in receipt of the vaccine. Even worse, no date allocated to attend for the inoculation. Mr. Ashford might like to answer this as the situation continues to escalate. The situation seems becoming catastrophic.
Well, as far as I'm aware, health and care workers are being vaccinated. Letters have gone out for expressions for people to register for the vaccine. I know some night workers that have been vaccinated. I know them personally, so I'm not quite sure where that's come from. The process of vaccinating the healthcare workers is ongoing. It's not finished. It's not at an end. It's still carrying on. So if that person hasn't been vaccinated, I would urge they speak to their line manager and get themselves registered to do so.
Because they're first in line, aren't they?
Yeah, they are, and like I say, the expressions have gone out across the HSC. I've seen some of the invites going out to staff asking them to register to be vaccinated. So I would urge, if that person does have concerns that they don't seem to have seen anything or they haven't gone forward yet, to speak to their line manager and it can be arranged, because they are the very first phase and those vaccinations are taking place.
Booked the first available appointment for a vaccination for my 88-year-old mum who got her letter today. This is a few days ago, by the way. The first available date was February the 15th.
Right, I'll clarify this because it came up at the press conference, interestingly. And I must be honest, I'm completely losing track of the dates now and days as to where we are. Days are merging into one for me, and I'd forgotten at the press conference. I was thinking we were still early January. We're actually the 15th. We're actually the 15th of January on the date of the press conference. So in fact, the 16th, 17th of February is actually only 4 weeks away. So that would be correct. Within the over 80s bracket, there's 4,800 people that require vaccination. And as I've said, we can only vaccinate as quick as the supply that we actually have access to. So it is correct that people will be getting appointments towards the back end of February for the over 80s. I hadn't realised, because we were doing it in batches, that quite so many of the 4,800 letters had already gone out, but I believe the vast majority of those letters have now gone, and Isle of Man Post Office has been exceptionally efficient in putting them out.
And it's really, really important people look in their mailbox each day and open their mail, right?
It is indeed. And once someone has received a letter, from that point on, they can ring 111 and book their appointment. But I need to stress again with the vaccine programme, as I say, it may look like it starts off slowly, because that's due to the way the deliveries are spaced from the manufacturers, because huge worldwide demand, they've got to manufacture the supply and get the doses into the UK. But then once you hit March, that is when, based on the current delivery schedules, obviously delivery schedules are always subject to change, but based on the current delivery schedules, that's when the delivery numbers ramp up as the manufacturers have produced the vaccine.
The next one's come up in various forms, and I think we've actually tackled it in the past, but let's go again on the gardener who can't work on his own and would be socially distanced. And they've also said you can't go along to a garden centre, yet you can still go and buy a car. You can go for a coffee, get a bus, get a taxi, grab a coffee again. The supermarkets, not all of them have gone one way, but that may have changed since this has been done. So please explain.
Yeah, so the point of it is that this lockdown isn't just around stopping household interaction. It's also about limiting movement and trying to limit people's movements around. So that is why, for instance, window cleaners and gardeners at the moment have been not advised not to work. That was exactly the same during the first lockdown as well. As we start to release things, then they will be one of the first to be considered to come back online. In relation to supermarkets, coffee, there's very strict rules around that. It's got to be takeaway. In terms of the supermarkets as well, that is only for essential supplies, same as the first lockdown. It's actually guidance that people should only go shopping as few times as possible. So it's very different. The taxis we've already touched on around people do still, for various reasons, need to move around. You will have people who may be in circumstances, for instance, like me, who don't drive at all, but still need to move around. But the taxis have very, very strict protocols around them as to what they need to do. But certainly I know gardeners and window cleaners, and I've spoken to a few of them, like the first lockdown. Obviously, as we release things, we will try to bring them back online as quickly as possible. But the purpose of this lockdown is not just to stop household interaction. It is also to limit the amount of movement going on as well. And it is, and the view that has come through, gardeners and window cleaners might disagree with this, but the view that has come through is they are not an essential service.
Okay, they may disagree with you technically, but anyway, there's a chance on Monday. I'm getting the vibes from that last meeting that you may, if all goes well on numbers, there may be slight easing, or is that too early to say?
Well, it's Sunday today, Paul, so it's far too early to say because no meeting has taken place yet.
Okay, now someone here is talking about a new drug that's being produced and on trial in Southampton, Synigen. I hope that's right. It costs around £2,000, which is not that expensive for a hospital treatment. Is the Isle of Man going to partake in a study or pre-book an order with a supplier of this drug?
Yeah, that particular drug I am aware of. It's still very, very early days in terms of the trials. We're talking right at the start of trials and testing. There's lots of different drugs, and in fact, I think it was raised at one of the press briefings with the Director of Public Health. One of the other drugs that people have been saying has an effect on COVID-19. The Isle of Man doesn't normally take part in drugs trials, and the reason being because of the size of our population, we're not seen as a widespread sample in terms of feeding into the trials, so we're not normally included in things like that. We do monitor, obviously, things that occur with drugs, and if it's proven from the trials that it has an effect, then if required, we'd consider using it. But it is important to let the trials run because we have seen lots in the media, the international media, this is about wonder drugs with COVID-19 that then when they're tried and tested don't turn out to be the wonder drug and actually could be quite dangerous.